We're a medical cooperative delivering health care in Texas and in Oregon. And I want to show you a little bit about what we do and why we do it and how we do it. And the first slide you're looking at is an example of the cost of health care in the United States. If you'll see on the far left, that tall bar shows that people are paying over $10,000 a year per person for health care. That's what's paid by their insurance and also paid out of their pocket. And then in other parts of the world, you'll see it costs about half as much, and that's the center bar. And on the right is what we've been able to achieve through a cooperative. And it's taken us about 10 years to achieve this. And one of the reasons for doing this is because healthcare has resulted in a lot of injuries and death in the United States. And it's been reported over the last 20 years. Every year we have an enormous number of people that die as a consequence of medical care. And the reasons are listed in this slide. It shows adverse drug reactions, medical errors, bed sores, infections, malnutrition, outpatient procedures, unnecessary procedures, and surgery-related things. So hospitals and facilities where people are getting care are dangerous, and they haven't been able to make it safer. And so we want to do that, and we only can do that if we come together as a cooperative, discover what the causes are, and fix them. So what are the alternatives to this death and bad health care? And the answers are that you have to make an alliance with your friends and neighbors. All of you create a cooperative, and you agree on prices and payments with your chosen physicians. You separate the money motive from the care that's delivered. And together you learn the causes and the cures for sicknesses and accidents and the financing and payment methods. You put the insurance companies and you put the government in the back seat and take them to where they need to be. Who are we? Well, we're a nonprofit association of physicians and patients, and we started out in 2005 as a nonprofit clinic, a charity clinic, and we qualified as an association after 5 years. And when we became an association that was qualified to buy insurance, then we were able to get the protection that we needed for all of our members. We had to become a discount medical plan. We didn't understand that in the beginning, but anybody that negotiates prices for patients with hospitals and with physicians has to have a license. And this is true in almost every state, that you have to have a license as a discount medical organization. And our license is 1721390 in Texas. And of course it's carried over and into other states where we're permitted to do business. We also, since we collect money and we pay money that belongs to other people, then we have to become a licensed third-party administrator. And we became that. And our license number for that is 137658007. And then we had to become a general line insurance agency. Since we were buying insurance for our members from licensed insurance companies in Texas and in other states, we had to get a general insurance agency license, and we have that. Then we had to be approved for a purchaser as a group of insurance. And so we were a qualified association. We got 5 years of feet on the ground, not doing insurance purchasing as a nonprofit organization. And that allowed us to get an insurance policy approved by the state of Texas that covers our members for hospitalization and health insurance, and also for catastrophic stop-loss insurance. Then we had to find physicians that would contract and become members of our association and help our patients and provide services for them for agreed on prices that were fair and reasonable. And so we became a representative for contracting for physicians and hospitals, and that made us into a medical services organization. So we developed chapters of the cooperative, the patient-physician cooperative, and we'll do that for anybody that's interested in their local area. What are the benefits? Well, the first thing is we found everyone that's a patient, and sometimes the physicians too, especially when they're patients, need a patient advocate. You need somebody that will get through the difficulty of getting health care and then sorting through all the bills and all of the procedures that are necessary to get things taken care of financially. So you have a patient advocate for every member. And then we had to have advanced knowledge about all of the prices for the medical and surgical services. So that was an agreed upon price list, and we started by using the prices that were the fair and reasonable prices in the community, and they're very close to the prices that are set by the government for the Medicare population. It ranges from 100% of Medicare up to about 130% of Medicare. But all of the people that provide services have it within that price range. And then we had to put together monthly payment plans so that people didn't have to come out with large amounts of money if they had a sickness or an accident because of large deductibles on their insurance. So we had monthly payment plans for primary care, for lab, for imaging, and for specialists. And we call these retainers. And that makes people avoid not having money to pay for health care when they need it, since they're already, deposited a retainer with the physicians and the facilities where they might need services. Then we have group association medical insurance, hospitalization insurance from Pan American Life, and it covers the expenses from $0 to $50,000. And we have association group stop-loss insurance that covers us from $50,000 to $5 million. Then we have roadside assistance, telemedicine, and then discounts on dental, vision, and DME. And that's the basic benefit package. Now, how do we compare to the market? Well, in a general way, I show what Medicare pays for a patient, which is about the average cost for a patient and Medicare, is about $18,000 a year. And the patient out-of-pocket expense for that is approximately $3,600 a year, and the premiums they pay for supplemental insurance and other kinds of insurance they need not covered by the Medicare plan makes their total out-of-pocket about $6,000, $6,338. Then when we compare it to the private group plans that are available, the high options and low options, they're also costing the patient $6,000 out of pocket in round numbers. And if a person had no plan at all and they had to pay cash and they could average out their cost over their lifetime, they would still pay $5,600 a year for health care, but they would run the risk of having a catastrophic event or having a large expense in 1 year that would drive them into bankruptcy. So the no plan option, while it's a little cheaper than the out-of-pocket expense over the long haul from Medicare and the private plans, is still too risky for most people to do. But with us, you don't have to worry about the catastrophic expense and the sudden upfront cost, and our cost is out-of-pocket plus the membership fees and the retainers and the insurance is $4,296. So we're saving members about 35 to 40% over what they're paying right now out of pocket for health care. Now, compared with United, we had a customer that had a group policy with United, and their cost was $800 for the employee, and ours was $439. For the family, it was $2,400 and ours was $1,390. So it's almost a 50% savings against United. And with Blue Cross, it was even more dramatic because it was two individuals and they were paying $900 compared to $333 with us and $2,300 for the family compared to $1,166 with us. Then there were pharmacy discounts. Now the best deals in the market were costing $442 for a drug that we got for $16, $902 for a drug we got for $100, $80 for a drug we paid $17 for, and $16 for one we paid $1.43 for, and $8 for one we paid $1.95 for. Now, what do you need to do? You got to become a founding member. Now you can do it as an employer group, you can do it as an individual, you can do it either way, it doesn't make any difference. But bring along your family and friends, and if you're in an employer group, this is a way to have coverage for your dependents that you might not be able to afford on your normal group plans. Then you can have your own health care plan at a much lower cost. You get health care when and where you want it. And so we have a saying that we read about that we like, and it says, the patient will see you now. It's really to say, who's really in charge now? It's the people that need the care and the people that are paying for the care. That's it.
Go ahead.